McGill University Health Center, we had very significant nursing shortages. We had fiscal constraints. At the same time, we had a nursing workforce that was tired, had considerable overtime in the organization. We had vacancies because of the shortages, and we were not scoring at the top levels in terms of how nurses saw the health of the workplace.
Project, so then it should be point form, so for the staff to know exactly.
Transforming care at the bedside, or TCAB for short, is really about engaging the hearts and minds of frontline staff in improving the quality of care and the quality of the work environment.
Idea coming from one of the
TCAB was really about going to the front line and teaching them to lead quality improvement activities
and
themselves.
Here we can see also the percentage
changing an environment, changing processes, changing a culture is complex.
Questions into your intervention.
Engaging patients, representative and patients, is crucial. It gives you more ideas, you have more creativities, and new solutions with them.
The journey of partnering with patients on a weekly basis and talking about the ABCs of frontline care was a completely new experience.
When I heard about it, as a patient intimidated by all these people.
We were teaching people new skills, we were all new at it, and it took time for the trust levels to grow.
We want to make sure that the patient is able to be part of this whole process.
Somewhere around the 6-month mark, we started to see a real shift. The staff became more comfortable with what we were trying to teach them. The patients also were becoming more knowledgeable about it, so that it became much more of a dialogue of patients asking a lot more questions and making suggestions and saying, well, but what if we tried this instead?
Correct, Mario?
Right. Patients also are very disoriented when they get into surgery.
Many of the changes they've made seem small.
They need to know what time it is and what time of the day it is.
But in fact, when we start counting up the number of minutes saved, times the number of nurses on a unit, times 365 days out of the year, it's very significant.
Attention, attention. Code yellow. 6 minutes.
Where we lived.
So
we didn't use it. We didn't use it yet.
Me and the children?
Yes, that's okay. We even have a few. Well, information. We have the nurse and physiotherapist, the ergotherapist, the names of all the people he sees every day.
For all of them. It is really, I like that very much.
So this is our patient and family room. You can see our orange wall that we're going to plan on painting more beige. And on this wall, we had a bunch of information on cancer that patients were telling us was too much for a family room, that they wanted to get away from all
Everything speaks of hope, and we even speak of hope with words there. And the flowers, people here need to flower again.
Do you live in an apartment, or are you living in a group home? How do you manage your finances? Your mom doesn't. Do you have any kind of social assistance or anything?
Do you have any friends or family that live nearby? How close is she? How close is she? She's in the building? She's not.
From our own experience here, the evidence is pretty clear about what one needs. First and foremost, you need courageous and stable leadership. Courageous and stable leadership, particularly at the executive level, is all about keeping one's eye on the sparrow, so to speak, but it's really about maintaining that vision and objectives and measurements to show that we're making progress on it. So keeping that attention focused on that corporate objective is critical.
For improvement, where it would be? We should have
another key part is about the support, recognition, and reinforcement that's needed for the frontline staff.
A clock from the team of TCAP.
These are the people who really know care best. They're the ones who face the obstacles and the barriers, and they have been waiting long periods of time for us to address the system level issues that get in the way.
Questions and all that from the patient.
What we've really learned through this is that by arming them with knowledge and skills and competencies to test out changes, they actually have considerable influence and power to make those changes happen.
So when we come in here, you welcome us with open arms. I think that this is the greatest achievement.
I think the other just really very powerful thing for me has been to see how much better the answers and the improvement ideas are when patients are there co-creating it with them.